Like many of her nursing colleagues, Pat Paolisi loves wearing her colorful print scrubs while tending to young patients at John R. Oishé Children's Hospital. Pediatric patients especially love to see Mickey Mouse, Santa Claus, other favorite characters, and seasonal themed prints that the nurses wear. The designs calm, cheer, and sometimes become a talking point. The same holds true for adult patients in other hospitals who also love the fun patterns, nurses say. I always have worn prints because the children love them, said Paolisi, who has been a nurse at Women and Children's Hospital for 28 years. They love the characters. Children react to that and they love that. All that could change for nearly 3,000 unionized nurses at Children's and the other Kaleida hospitals. The healthcare provider is considering a dress code change that would require nurses to wear solid color scrubs and no longer the prints that they buy themselves. Long term, Kaleida would like its nurses to wear gray uniforms. The change to solid colors was on tap for January, though union officials insisted such a change can only occur if it is negotiated in the next contract, which expires in May 2019. The two unions representing the nurses pushed back, saying they were only required for now to discuss the uniform issue as part of their current contract. Kaleida said it wants to reinforce what it terms the standards of appearance and make sure their nurses are easily recognizable. Our objective is that the standards of appearance reflect the standard of nursing care we deliver across our system, said Cheryl A. Class, Kaleida Executive Vice President and Chief Nurse Executive. Nationally, clearly identified registered nurses support feelings of trust and confidence. We want our patients to know who our registered nurses are. Talk of the switch sparked debate between the union and Kaleida and led to nurses' resistance spilling over into social media. Nurses pay for their uniforms, which cost about $60. Full-time nurses typically need a minimum of 3 sets to handle 12-hour shifts throughout their work week. A nurse wears a patterned top while working at the Old Women and Children's Hospital. Derek G/Buffalo News File Photo. The Service Employees International Union Local 1199 Upstate and CWA Local 1168 officials, nurses and a Kaleida team met a handful of times late last year. The unions filed a combined grievance, arguing they viewed the matter as a mandatory subject of bargaining. You are backdooring it by saying everyone has to go into a solid color, said CWA Local 1168 President Corey A. Gambini, a registered nurse at Millard Fillmore Suburban Hospital. Kaleida stressed that patients and family members can get confused by trying to identify nurses if various staff wear different uniforms. On a broader scale, Kaleida officials also say solid-colored uniforms are part of a national trend at many healthcare facilities. Others argue that the popularity of prints outweighs opposing opinions. We wanted to stress to Kaleida the importance of leaving the current policy intact. We think it's important that the nurses are able to wear what they've always worn, said James Scordato, SEU 1199 Western New York Area Vice President.